Okay, so welcome to BARHII's general meeting on fair housing. And I think this is a very timely topic. I woke up this morning thinking about W.E.B. Du Bois's book, Black Reconstruction, which is a book about the Reconstruction period following the Civil War, in which a coalition led primarily by black organizers and then also other progressives in the South and the federal government pushed forward a whole series of reforms, including things around racial justice and also public services. So this was the time when actually public health, some of the earliest public health programs were birthed in the United States. It's also the time that the universal public education was birthed in the United States. And I've been thinking a lot about this period because there's three elements of it that are very similar to today, I think. One, in that it was a period of really strong leadership, organizing, and confrontation, led by folks of color and black people in particular. Two, it was a time in which racial justice demands were connected to broader gains in public services, so the public health and public education pieces that I mentioned. And three, there was a lot of conflict. There was really powerful black organizing and also vicious backlash and violence from the white power structure. This political moment ended by 1877 as racism split up the coalition. And it ushered in the brutal Jim Crow era. And these characteristics were also present in the civil rights and black power movements of the 50s, 60s, and 70s. We saw a similar combining of racial justice, moving forward on racial justice and also moving forward on a broader set of civil rights and public services. And some commentators and historians have argued that we're in another one of these periods, another time where there's tons of confrontation, there's a lot of pushes and organizing. For instance, like within BARHII, we've been studying the Movement for Black Lives platform, which is a bold vision for racial justice, and also for public health and healthcare and environmental protection and public education and things like that. And I think no one would argue that we're also in a period where there's some serious backlash, both to racial justice movements and to a lot of the things that we as public health have championed. And so today we're going to talk about one piece of this arc of civil rights struggle and also of health equity struggle, and that's about housing discrimination. And we're going to be looking really specifically at the Fair Housing Act, which was passed in 1968. But then in 2015, there were provisions that were added to really strengthen it and allow implementation on the ground. So we're going to hear from two fabulous speakers about that and about challenges that are happening right now. Rita's posing. Yes. So about challenges to some of this legislation as well. So both this push and pull. And in a minute, I'm going to turn it over to the speakers, but I wanted to just quickly get started making some of the links between housing and health. Okay, great. So we as BARHII have talked a lot about housing and health in the past. I was looking through our notes and found a meeting back in 2013 on this topic and specifically about structural racism. So this is something we've been covering for a long time. But a refresher, some of the ways that housing and health are related are conditions in the home. So this is the most obvious of, are you crowded? Are you subjected to lead poisoning, asthma triggers, things like that, injury? Housing affordability is obviously a clear one of cost burden, like what do you have to give up in terms of food or medical care or education, or being forced to move in order to afford rent or a mortgage. And the converse of that, like housing can be a really good way to build wealth for those that have access to good credit or good loans, and can open up a lot of other kinds of opportunities. And finally, where you live allows you access to a whole suite of neighborhood amenities or things that are in your community. So that can be health services, that can be education, jobs, healthcare, parks, pollution. There's so many more that we talk about a lot as the social determinants of health. all of these pathways are subjected to housing discrimination, right? So like people have really different access on all of those different things. And discrimination happens both very explicitly, so people saying, like outright segregation or outright discriminatory lending being one example. And then there's also discrimination that can be ostensibly race neutral, right? Like it's not talked about in terms of race, but still it has racially disparate consequences. So we see that with housing affordability. An explicit version would be discriminatory lending, whereas a race-neutral version might be cuts to affordable housing programs that some folks rely on disproportionately. Or we saw an example of policing in Section 8 housing, for instance, in one of our counties to try to keep folks out, and specifically keep black folks out from affordable housing. Actually, that's that is very much explicit, so I should put that in the other column. But we see similar things around neighborhood conditions. So in the past, there were racially restrictive covenants that just said straight up, like, if you're a person of color, you can't move into this neighborhood. More commonly today, we have race-neutral kinds of discrimination. For instance, excluding multifamily housing in higher-income neighborhoods. Gentrification can do some of this work. Environmental racism and pollution is another example here. And then conditions in the home are another place where biased leasing or the exploitation of tenants is just a very clear, explicit version. Or something like utility shutoffs in foreclosed housing or lead poisoning in communities of color are ostensibly, again, race neutral, but underneath there's very severe discriminatory consequences. So that's kind of the framework that we're working from. The picture on the left should be familiar to most of the health people in the room, which is life expectancy at birth by census tract. And the picture on the right is a dot density map of race in the Bay Area. We know that where you live, the neighborhood that you live in, changes your odds of being healthy. And unfortunately, there's a very strong correlation often of the things that can help people help increase those odds, correlating with communities of color, and in particular Black Latino communities, and Pacific Islanders and American Indian communities in the Bay Area.